we have a very special guest joining us this morning, Dr. Kristina Butler, gynecologic oncologist on ovarian cancer. Dr. Butler, good morning.
Good morning.
Nice to see you. Yeah, thank you for coming in.
Absolutely.
This is an interesting conversation here, talking about ovarian cancer. What's the launching off point? We're talking about Chris Evert. What's going on right now? I've been sort of out of the loop on this.
Yeah, so she has a recurrence of her ovarian cancer and is undergoing treatment, and there is a lot of hope on the horizon for women with ovarian cancer, but also a lot of awareness. So I really congratulate her and appreciate that she's sharing her story so that we can learn from it and share that with other women.
You know, we were chatting just a moment ago about the idea that I'd done a number of stories on this and emceed a number of different events over the many years, organizations that are raising money for ovarian cancer research. And years ago, it was a complete death sentence because you never really found out until it was too late. But things have kind of changed a little bit.
Absolutely. So not only is the incidence reducing because of awareness and options for women, but also the risk of death is declining. So we're having better outcomes for women, which is, again, a kind of a segue to the hope that I think is very important for women to understand and not feel overburdened if they are diagnosed.
That's incredible to hear that hope. And getting back to what you said at the beginning, it is a deeply personal. We're talking about the possibility of losing your life to this. It's a deeply personal thing. Whatever public-facing job you have, that becomes a very private matter immediately. So the idea of being brave enough to open up and talk about that, and to do it without tears streaming down your face, right, and to be able to do that, hats off, because it's important to do that. Because now we get to talk to you, right? I'm not sure this conversation happens without that conversation happening. And now there might be someone in our chat right now who learns a really important thing because of that. And I think that's the incredible sort of chain reaction of it.
Yes, she's an amazing survivor. And the disease also affected other women in her family, her sister. And that's an important thing for awareness, that you be aware of your family history, ask your family members what's affected them, because there are some genetic mutations that could be identified that allow women to then have better screening and better options, better outcomes if it's caught early.
So that also, if she has a family history, then maybe the BRCA gene could be an effect. And you mentioned it's not just for breast cancer, but it also is something that you can do for ovarian cancer as well.
Absolutely. So the BRCA mutation 1 and 2, and there's many others, place women at increased risk for ovarian and breast cancer. Yes.
What are the symptoms and I know it's difficult, right, because it's something that happens deep within us as women, but are there different symptoms we might be able to look for if we feel uncomfortable or we're worried about something?
Absolutely. So the symptoms are difficult because, as you mentioned, the ovaries are deep in the pelvis. They might grow a little bit or have a cyst with your menstrual cycle, and you may not notice. But the symptoms that we ask women to be aware of are the symptoms that come and stay. So if you're bloated, feel abdominal fullness or pain, feel full quickly after a meal, those are important things. If that happens about 2 weeks out of the month, that you seek evaluation, because it could be a little GI upset. But if it persists beyond 2 weeks or into another month, then that's something to definitely be evaluated for, because those are those vague symptoms that women might otherwise just brush to the side.
You mentioned also that medicine has evolved to a certain level as well, where I mentioned that I was speaking with a woman who has had stage 4 ovarian cancer, but she was living her best life, and she said she was on medication every day. Is that relatively new?
So she may be on something called a PARP inhibitor, and those have changed the landscape of outcomes for women with ovarian cancer. And it is so convenient that it is a pill you can take. You don't lose your hair as you do sometimes with chemotherapy, and then you're able to have improved outcomes. So those are new, and the increased use, particularly in women with the BRCA mutation, but also many other women with ovarian cancer, have drastically improved outcomes, which is really a gift.
I want to talk about you for a second. You have a very challenging job and a very emotional job too, because you're talking with patients all day long with a whole wide range of outcomes. When there are new tools that provide new hope, that's got to be emotional for you too, because that changes the conversations you get to have with patients.
Oh, it helps me wake up in the morning.
Yeah.
And I have my research lab at Mayo Clinic. We're very committed to clinical trials. We have extremely exciting trials for women. It makes it an amazing journey to go hand in hand with women as they really struggle through something that's very challenging.
Yeah.
You know, the Mayo Clinic, I just have to, I haven't shared this a whole lot on the air at all, but my husband had cancer a few years ago. And we went to the Mayo Clinic and they did the surgery there, recovery, and it was the most amazing place. So thank you for what you do. It was a really hard time, and everybody came through and really supported our family in amazing ways.
That's wonderful.
So thank you.
Yeah.
Do you have resources online for ovarian cancer as well, if anybody out there has any questions?
Yes, our Mayo Clinic Cancer Center has a wonderful website. We have links to our clinical trials. We have education regarding abnormal symptoms, other screening modalities, detection, all of those things.
Okay, wonderful. Dr. Butler, nice to
Yeah.
meet you.
Good to meet you.
Great
as
to
well.
have you in.
Thank
Thanks
you
for
for
having
coming
me.
in, and thank you for what you do.
Thank you.
Have a great day.